Testing 1 2. Testing 1 2 3 4 1 2 3 4. Testing. Check my 1 2 1 2.
Hello. Good morning.
Good morning, Professor Babatunde.
Good morning.
Good morning.
How is the conference?
Good. How are you?
Yeah, nice to be here. I'm good.
Oh, Alhamdulillah. Have you had your breakfast yet? Have you had your breakfast yet?
Yes, I just did.
Ah, that's good.
Yes, I just did.
Okay, that's good. Okay, so hang on a second. Okay, let me ask. Did all of you guys enjoy your lunch? Yes. Okay, good. Okay, so now, welcome. Let's give a round of applause. Welcome our Breakout 2 Chair, Professor Dr. Babatunde Emmanuel Jaiyeoba from Nigeria.
All right, thank you.
No problem. So, Prof, I give the floor to you.
All right, thank you very much. So, good afternoon, panelists that are there. It's good to welcome you to this Breakout 2 of the 13th conference of the Asian Conference on Environment and Behavior. So we have 6 papers for this session. I hope all the 6 presenters are there. Please indicate if your collaborators that are not within the country have joined, so we can welcome them formally. So if we are set, the first paper is by 4 authors. It's into the adoption and behavioral aspects of energy storage, a bibliometric study. Can we have Mohammed Farouk, Mohammed Supian to present? Thank you. Please, you have 10 minutes only, and then we have interaction time of 5 minutes. Please, let's keep to time as much as possible.
Testing.
So other panelists, please, let's get ready with our questions and contributions to the presentations in this Breakout 2.
Oh.
So I should start now, Prof?
Yes, you can start.
Okay, right. Thank you very much. So, Assalamualaikum and very good afternoon, everyone. So today I'm going to present our research findings on the global insights into the adoption of behavioral aspects of energy storage and bibliometric studies. It is research and findings or preliminary result that we for our projects. So my name is Dr. Mutali Aljuni. So I'm from UITM, which my affiliation will be microwave research. Okay, without further ado, I'll go straight to the abstracts, the findings that we have.
Sorry, let me ask quickly. The man from Oman, is he online or around?
I'm alone.
Your collaborator from Oman?
No, he's not joining us.
Okay. Thank you.
Okay, you're welcome.
Continue.
Okay, in this study, so we're going to see the aspects of adoption and behavioral aspects into energy storage. So our findings, we make some thorough investigation on 2 databases, which is Scopus and WoS. So from 2007 until 2025. So the main focus will be on the shiftings of the technical studies or to studies the behavioral and policies adoptions and to combine the technologies and economic regulation. So the main important topics that we we like to study is battery storage, renewable energy, and economic impact. So to make it make sense, so why it matters is help to shape the better policies, smart investments, and public support. Okay, let me give you some introductions or some literature reviews on the things that we cover. So actually, we like to study on energy transition because right now they are moving from the fossil fuels to the renewable energy. So that's why the energy storage is very important right now. So energy storage covers like a battery, supercapacitor battery, and there are many more, like mechanicals, energy storage, and so on. So actually the research gap is to many studies focus on the performance, cost, and integration. So very limited studies covers on the adoptions and behavioral aspects. That will be the key important why we are doing this study. So why this method? Review the emerging research teams and interdisciplinary linkage and support the policymakers, industry, and researchers with evidence-based insight. Okay, let me go straight away to the methodology. So how we construct or how we develop this study. So actually we are using a bibliometric study. So we're looking at two databases, which is Scopus and Web of Science. So on the top of that, or on top of these tables is our search string that we are using for Scopus and Web of Science. So after we have completed, identify the keywords and make a searching, then we make a thorough analysis by using a CytoPy and WoS viewer as well as a bibliometric BiblioShiny. So this is the frameworks of the study that we have used. Okay, let me go straight to the result of the analysis. So this is the numbers of paper that we are getting from the both WoS and Scopus. So about 32% has been removed from the WoS database due to the similarities, and then as well for the Scopus, 69% has been removed. So we can see that the trends of publication from for both conference and journals, you could see that the trend is slightly higher when we approach the 2020. So it shows that the demand or the studies on the adoptions and behavioral aspects is getting higher after 2020. Okay, this is the results for the journals and conference distributions that we make the analysis. So we could see that the highest will go for the energies journals, which numbers of document produced on the energy adoption and behavioral for about 6 papers. While looking at the country contribution, so the most papers come from United States, followed by China, Australia, Germany, and then the less papers have been produced from the other countries. So this is the key result, key research areas in the or keyword analysis. So we could see that the energy storage system is the highest numbers of paper generated. So which the information trend or adoption behavioral aspects of the storage keyword analysis. Then there are 4 clusters of the studies which related to the network analysis and key occurrence. Okay, this is numbers of paper which has been highly cited in the areas of energy adoption, energy storage adoption, and behaviorals. So, okay, with that, I conclude the findings that we have covered in this study. So, it shows that the adoption and energy storage is getting means that people are looking at that particular area thoroughly since 2020. And then the top contribution country will be the United States, China, Australia. Then the research focus will be the technology adoption, renewable energy, and energy storage, which the citation and network analysis shows that there are 4 clusters in that particular area. So the final thought, the analysis offer the data-driven guidance for the shaping policies, engagement consumers, advancing sustainable energy storage integration worldwide. with that, thank you very much. So this project is supported by the facility supported by University of Maroc and the grant from Meroz. Thank you very much.
All right, thank you very much for that presentation on a very salient issue that affects the world right now, which is energy, and this is about energy storage. Do we have any questions for him? Okay, while we're thinking about questions, I have one fast one. Your literature review started from 2007. What is significant about 2007?
Because we could not get any other publication before that. So the earliest publication that we could see from the database of WoS and Scopus in 2007.
Oh, all right. That means it became a very serious matter from year 2007. I also see that you said there were more papers that were published around 2020. What do you think could have accounted for that?
Okay, there will be a policy which is they're talking about carbon issues. So when we are talking about carbon issue, so we try to remove from the fossil fuel to the more sustainable energy source like solar, wind turbine. So you could see that the study related to the energy storage start to spike after 2020. So because before this, the studies on energy storage focuses on the technical parts, meaning that designing of the energy storage, integrations, configuration, and so on. But the adoptions and behavioral aspect is not really taken care. So since 2007, that particular area has been put the focus, which they are more on publishing on the policies part, how to integrate or to adopt the renewable energy in this particular to replace for the fossil fuel.
Interesting. So that means all the studies and research about renewable energy replacing fossil fuel really was heightened in 2020.
Yeah,
today it remains a very strong thing. Okay, that's interesting. And then again, most of the papers we see are from United States, China, and Australia. Why is it that the people that consume the most are also the people that are talking about the fossil fuel? What do you think is happening?
Okay, because
I suppose the developing world that is mostly affected by the effects of the pollution, climate change, and all that. We should have a lot of papers coming in from there.
So I believe that there will be the key factors on the policies about the climate change. Also, they are pushing their electric vehicles (EV) for the US and China. That's why they come up with the adoption, how they're going to adopt the energy storage. Because when you're using EV or electric vehicles, you must have a storage, enough sufficient or a well-equipped storage to make sure they're able to be used. I believe that will be the key strong point will be the policies and economy.
That's wonderful. Do we have any other questions or comments from the audience? Okay, I have it. So, after this paper, what's next? Are you still working on something related to this paper? As your next
Okay, actually we are not studying about the adoption. So we get the grant to develop the energy storage. So as a part of the study, we would like to see how people see or adopt the energy storage globally. So from this paper, we could see that the technology adoption is really focused on US, China, and Australia and Germany. There are only 4 countries. However, if we see that, or we predict that in the next 5 to 10 years, the developing country will focusing on this particular area, on the adoption, thoroughly.
All right, thank you very much for that presentation on storage of energy that is critical. And we're hoping that since you have blazed the trail in Malaysia, the matters of energy storage will now be on the rise in Asia. Thank you very much.
Sorry, one question, Prof. I just want to ask you, how did you clean, during the cleaning for the behavior metrics, because you combine the WoS and also the scopus, so are you using the conventional way to clean up all the messy data, or are you using any apps like ID, or you are using any apps for clean up instead of using the bigger shiny, maybe another application or yeah.
Okay, alright. Actually we're using a site profile to combine the database.
Okay.
Then because our data is not too huge,
okay.
So we can go through one by one.
Oh, okay.
Just
so,
do it manually. Because there is an issue. Because when you combine it between the journals and conferences,
yes.
So you need to do it manually. So I did manually.
One by one of the articles.
Because the numbers of people that we are searching is very small.
Small. It's not only 1,000 papers, right?
No, not even 200 papers.
Oh, so the data was cleaned around 150, or
I think it's
below 150.
Below 150.
I think it's more important. Thank you.
All right. Any other comments or questions? Okay, thank you very much for that presentation. Yeah. So we look forward to seeing you on developments on this at the next conference. So the next paper, the second one for this session, is the psychological elements in modern poems. We have Meroz Hotel that's going to give us this presentation. You have 10 minutes. It's okay, we are the only writer of this paper.
Good afternoon, guys. I'm Marshall from University of Sabah. The title of my presentation today, the psychological element in modern poem, Bintang Hati. In Malaysia, the most popular literary component, multi-nature, is composite, short form for component sastra, which is a mandatory teaching and learning module in the Malay language subject. One of the early studies on the role of literature in influencing psychology is the work of Lazar. In his book, Literature and Language Teaching Answer, Guide from Teacher and Trainer, which explains several benefits of learning literature. First, it motivates students. Second, it provides knowledge about cultural background. Third, it offers insight into language acquisition. For it broadens student awareness of language. Fifth, it develops student interpretive skill, and sixth, it educates students holistically. The study aims to understand how psychology elements in poetry not only enrich the meaning of literary work but also serve as a medium for emotional expression and self-understanding for reader. Okay, psychology is a fine understanding human behavior, describing or explaining human action, assessing and predicting behavior, controlling behavior, and ultimately shaping and influencing human conduct. Modern concepts poetry highlight many positive aspects through its meaning, themes, tones, value, and lesson. It provides teaching and moral guidance, indirectly serving as a medium to inspire and motivate reader, especially teenagers, to pursue and achieve their life goal. Arabian Sujo starts that literature is not merely a form of writing without direction, plays a crucial role in shaping an individual character. Carefully chosen a word in poetry can also stimulate the reader psychology. By Sarah Yaakob asserted that high-quality literary work can educate reader and ultimately produce an refined and well-rounded audience. An effective educational process can encourage students to contemplate goodness, moral integrity, constancy, truth, linguistic politicness, aesthetic beauty, resilience, and appreciation for life humanity. Research objective. First, identify psychology element present in the modern composite poetry to analyze the psychological element found in modern composite poetry. This study is textual in nature, analyzed documents, especially poem found in the composite book, using a qualitative approach. The textual research will incorporate literary element present in composite poem. Furthermore, the researcher applies the approach of Maslow hierarchy of needed theory. A total of 4 poems from the anthology Bintang Hati are the focus of the study. Bintang Hati is a composite anthology component in the language subject used by Form 3 students in secondary school across Malaysia. The poem includes in the anthology Kijang yang melelah, pesan ibu beribu-ribu, senja di palang besi dan bintang. The researcher has used literary element as a variable in the study. The literary element focus on include themes, meaning, charm, tone, value, and moral lesson. Next, the selected poems will be analyzed using the human need theory approach by Abraham Maslow. The psychological needs identified by Maslow are divided into 5 main components. First, psychological need, safety need, love and belonging, self-esteem, and self-actualization. However, after conducting the analysis, only 4 human needs were found to present. Safe need in the poem Pesan Ibu Beribu, love and belonging need in the poem Bintang, self-esteem needs in the poems Kijang yang lelah, Pesan Ibu Beribu-ribu, and Senja di Palang Besi. Self-actualization needs in the poem Pesan Ibu Beribu-ribu and Bintang.
You have 3 minutes more.
Okay, research finding. We have 4 safety needs. Elements, psychological, as physical safety and emotional safety. In the poem Pesan Ibu Beribu, verse 5, love and belonging need, love for the creator, love for fellow human. In poem Bintang, verse 2, self-esteem need, element appreciation, self-respect, confidence, competence, independent, freedom. In poem Kijang Lelah, verse 4, Pesan Ibu Beribu, verse 4, Senja di Palang Besi, verse 2, self-actualization, raising one potential certification with life. In poem Pesan Ibu Beribu, verse 3, and Bintang, verse 2. Integration, psychology elements are deeply embedded in ComScience literature. ComScience holds significant potential as a therapeutic medium, particularly for students and the general public. Integrating psychology perspective into literary analysis can exchange poetry role in promoting emotional well-being and psychology resilience. Recommended future research show further explore the relation between ComScience and poetry and psychological theory. Effort shall be made to disseminate this study to a broader audience beyond literary. The study ComScience poetry shall be diversified in involved through psychological, expanding the scope of research can extend the relevance of ComScience poetry in both literary scholarship and mental health discourse. And the conclusion, the interdisciplinary study of literature and psychology offer deep insight into human experience, emotion, and cognition. The integration of language with moral value, emotion, reinforce literature role as a vital field of intellectual inquiry. Ongoing research is crucial to evaluation literature, strength and limitation, psychology, perspective, emotional, provide value insight into human behavior and emotional complexity, warranty for the exploration and broader academic and public engagement. Okay, thank you. Sorry, my English is not good.
All right, thank you very much for that presentation on how psychology is used to mine into literature in terms of the text. Are there any questions for him on this interesting paper? Which psychological...
Okay, actually this is not a question, this is more on a response and opinion about the context of the research, which is similar to my research. This is in the context of the performing arts. That we use the performing arts as a platform to give the message and to evocate the people. But this one is more on students in school. We are using the literacy component in one of the subjects in school, which is for me the most important part is the practical part, how the student can deliver the poems to understand more about the message on the psychological behavior. Actually, this is a good research to give the message to the student instead of just learn by theory, so they need to practice and to create the character and how the character develop to bring the message, to put some emotional and to put some critical thinking about the message of the poems. This is the same context on my research actually, but my research is based on the song and lyrics, but this one is more on poetry. That's all. Thank you.
All right, thank you very much. You know, still talking about how these poems can really bring out the best in the students. I was going to ask the author, what level of schooling are the children that read these poems? Are they nursery, pre-primary, or secondary school?
Secondary, Form 1, Form 5.
Oh, secondary, all right. They are actually teenagers, you know.
Yeah.
So that means that they can really be able to have these psychological influences or psychological inputs into their poem. They can really understand if this analysis is really made known to them. That's really interesting. Thank you very much for this. We'll take the next presentation of feasibility of combined BFR education and physiotherapy program for patellofemoral pain, a pilot study. It's by 4 authors. Who is presenting to us today? Is it Aslinda Fuha?
Yeah, good morning, good afternoon. Assalamualaikum and a very good afternoon. Sorry?
I said good afternoon.
Yeah, good afternoon. I can't hear you.
Oh, okay. Good
So-
afternoon. I hope you are hearing me now.
Sorry, Prof, I can't
All
hear
right.
you.
Don't worry, you can start.
All right. So today I'm going to present about feasibility of combined blood flow restrictions, educations, and physiotherapy program for patellofemoral pain. So I use a pilot study to conduct on this topic. Okay, before I start, let me introduce about the BFR. So BFR is a new technique that the physios embrace, especially for those patients who have some musculoskeletal issues. So blood flow restrictions, as its name, so we actually compress the upper limb or the lower limb to enhance, to stop the blood flow towards the extremities, so that when you perform exercises, especially the low load, you will increase the capability of the muscles to perform better. So this study actually combined on blood flow restrictions, educations, physiotherapy, low intensity technique, and then we combine these 3 and then we apply to the patients. Therefore, I do a pilot study of 20 participants to check the feasibility of these 3 techniques when we combine it for the patients. So just now already mentions about the definitions of the BFR. So the purpose of this study is to reduce the pain, enhance the muscle strength, improve the muscles bulk, and improve the muscles length, kinesiophobia, and improve the quality of life with low load exercise. So the target group is for those individuals who cannot perform high intensity exercise, such as patellofemoral syndrome. So patients who have PFPS, like patellofemoral syndrome, they have a difficulty to climb up and climb down the stairs. So these exercises are very good for them. So let me explain to you more how. So this study, the objectives, I have 3. So first one is to assess the feasibility of the trial by evaluating recruitment, retentions, and data completions. The second objective is to monitor the implementations of the interventions, focusing on treatment delivery and enhance. The third one is to examine the contextual factors influencing effectiveness through feedback from both patients and the physiotherapy itself. So this is the literature review. Based on the all the literature's review that I found, the newest one, so therefore we created this technique, BFR, educations and physiotherapy low intensity exercises. So let me highlight. From the previous literature review, we found out that most of the previous literature review have some limitations in their methodology, such as the applications of the technique are different, and then they also have short follow-ups and limited patients diversity, and then the variations of the BFR protocol are limited. So each physiotherapy applies the BFR technique differently. So, and then they also have a very small sample size, such as maybe around 10 to 15. Okay, and then they only focus on short-term psychological outcome of the patients, And if you can see from the 2002-2020 literature review, the BFR educations and physiotherapy exercises, they are very limited towards the rehabilitation research. So most of the studies here, they focus on the lower back pain. Okay? So, okay, let me conclude about all this literature review. So this study, this table summarizes the focus areas, findings, methodologies, limitations, and future research implications for the studies on BFR therapy, educations, and physiotherapy interventions for patellofemoral pain syndrome. Okay, so for this study, I have 3 phases, but today I'm just going to talk about this phase. So this preliminary study is already done in year 2021. So this one was 2022. Okay, so how I do it? At start, for the preliminary study, I conduct an initial research, which I do an analysis of the phase 1, plus I do a literature review. Therefore, I created this theoretical product in phase 2, which I created the protocol of a prototype of BFR educations and physiotherapy exercises. And then I send for the expert validations. And then I do a single case study, which I already presented in, where? Bangkok?
No, the last one was at
somewhere. In AMER, for this case study. So after that, I do a revisions. Therefore, I created another pilot study from the case study. And then from the pilot study, I do a feasibility test so that I can prove that this study can improve the patient's well-being, and then I can focus on the phase 3 study, which is the stage of the product efficacy testing. Okay, for the patients easily understand. So for the first phase, I have 100 patients participant. Therefore, for the phase 2, I only choose 15 participants from the first phase. So my pilot studies have 20 participants. Okay?
You have 3 minutes more.
All right. Okay, so let me show you about the interventions video. So this is the exercises that I apply to the patients. And if you guys can see, oops, okay, if you guys can see, this is the blood flow restrictions, the machines itself. So I'm going to explain about my co-host will, my co-participants will talk about the result analysis. Can you play the video? Thank you.
Where's your co-participant?
She has some issues, so I already asked her to do a video. So she will present through the video. Alright.
Experimental group. In this discussion from this study followed Concert 2010 guidelines with large sample size and longer study duration. This study is the first study with integrate BFR, ED, and IIT for PS rehabilitation and recommended to validate findings and optimize this intervention, supported by Faculty of Health Science, UITM, and Brain GIP.
Okay, so this program offer a non-invasive, time-efficient rehabilitations for the patients itself. So this is a very new study. Yeah, thank you.
Oh, good now. All right. That's good. That's good. That is a therapy paper by 4 authors. 2 people presenting. Do we have questions?
Sorry, Prof. We can't hear you. Your voice is so soft.
It must be a technical thing. Are you hearing me?
Very soft.
Oh.
Prof, maybe the mic.
Hello?
Yeah.
Are you hearing me now?
Yeah.
It's better, right?
Yes.
Okay, thank you. I said that was a very interesting paper from a physiotherapy and health point of view. Do we have any contributions from the audience, from other panelists, conference attendees? Let me see. When you talked about the stages, this your project has gone.
This project.
You only have 20 participants.
Yeah. This is for the second phase. For the third phase, I already because of these 20 participants, I want to check whether these studies are feasible to go for the third phases, which is the actual study of everything. That's why I do this feasibility test.
Oh, okay. This is just like a pilot study. You are still going to do a bigger sample.
Yeah, I already did it. So the biggest sample was 150. I just completed it last year. Yeah, so I already combined it into my thesis and then waiting for Viva this May.
So what's your phase 3 going to be like?
Sorry, Mike?
Your stage 3, what's it going to be like?
Already completed, sir.
All right.
Yeah.
So you still be bringing us the phase 3.
Yeah, maybe in London I will present the phase 3 paper.
All right. That's really interesting. Thank you for that.
Thank you.
Physiotherapy paper.
Yeah,
It's interesting from a rehabilitation point of view, and we're hoping that we wish you all the best in your fiber.
Yeah, thank you, sir.
All right. Thank you very much for that nice video.
Thank you.
Okay. Paper number 4 is public awareness of chronic kidney disease in Malaysia. You have 10 minutes.
Okay, Assalamualaikum warahmatullahi wabarakatuh and good afternoon. So today I would like to present our paper on public awareness of chronic kidney disease in Malaysia. Okay, before I would like to proceed with my presentation, I think if I ask you whether you know about your kidney health or not, one thing, and I think maybe it will make you sad because we just finished our lunch. Okay, so this me as Fatima Sham from UITM, and this is my team member for this study. Next. So what is chronic kidney disease? It's a non-communicable disease in which the persistent abnormal inner structure and the function of kidney which occur more than 3 months. So if you have these kind of things, you will have the CKD or the chronic kidney disease. So the prevalence of this CKD is increasing, in which more than 10% of general population worldwide is having this CKD, and in Asian population is also significant and advanced. How about in Malaysia? So in Malaysia, the incidence and the prevalence is rising over the past 20 years. Partly why? Because of the NCD, the non-communicable disease such as diabetes, hypertension, and of course our aging population. And poorly, there is no definition of cure for this disease. So this disease, the CKD, is a risk factor for cardiovascular disease, which lead to premature death, the end stage of renal failure, and of course its increased financial burden, in which our patient will have hemodialysis and peritoneal dialysis. And the management is largely depend on the early detection and prevention of the disease progressions. So next. So what is the problem? CKD represent a growing health burden in Malaysia. So what is the issue? The public awareness remain low, contributing to late diagnosis and poor disease management. So what is the implication? The number of patients requiring dialysis is projected to be more than triple in 2040. So what are the challenges? So the challenges is the high prevalence of CKD and the use of unregistered health supplement which have linked to the adverse event of the renal. So what is our intention for this study is to assess the CKD knowledge and identify the association or the predictors among the public in Malaysia. So with this finding, we'll give a proper understanding about the CKD and will support the development of public education initiative, promote early detection and effective disease management to prevent CKD progressions. So next. So this is our literature review. So I would like to summarize our literature review. It's a major global health concern, but yet our public awareness is remain inadequate. And you can see studies shows that significant knowledge gap regarding the risk factor, the symptoms, and the treatment. And research from various countries revealed that there is a misconception, particularly about the herbal treatment and the disease management. So this is all the factors that contribute to the CKD disease, such as socio-demographic and the population. Next. So what is the methodology of this study? First, this study was a cross-sectional study conducting in the two states in Malaysia, in which this two states is the higher prevalence of diabetic in Malaysia, which was the contributing factor for the CKD. The population is the gender population. Sample size, we use Rosoff sample size calculation, and our sample size is 1,391. We use a convenient sampling, and this is our inclusion criteria. And we managed to get the ethical approval from our institution, ethic committee, and of course from the respondent. And we use a research instrument. It's a validated research instrument in which we also managed to get approval to use this instrument, which consists of two sections. One is the respondent characteristic, and the other one is the knowledge of CKD. So the knowledge of CKD consists of 24 MCQ, multiple choice question. So for the validity and reliability, we conduct a content validity. We use to translate the questionnaire to Dui language, and we conduct a pilot study which our compound alpha is 0.84, means indicate that the questionnaire internal consistency is good. So for data collection, we conduct the data collection from June to September 2024 in a public space in which we distribute a Google form link. And also, we also distribute the questionnaire using the social media. And our respondent rate is 100%. For data analysis, we use SPSS and we conduct descriptive and inferential statistics. Now we go to the result. Next. So this is our result. Majority of our respondents' age is between 31 to 60 years old, Malay, female, work at government sectors, have tertiary education, live in suburban residency, married and under B40 economic status. Next. So if you look at the lifestyle, if you see here, we have quite a number of population, the gender population who are smoked and consume alcohol, in which these are the factors that contribute to CKD. And if you see here, only 26.7% of the respondents have an active lifestyle activity, the physical activity which recommended by the health guideline. So as we know, when people are more active, they can able to control diseases like diabetic or hypertension. Okay, so for the next one is the history of osteoarthritis. So osteoarthritis, mainly patient will have pain. So they will depend on using of painkiller and NSAID medication. These two factors are the most factors that contribute to CKD. And how about the herbal medication? If you see, there is 28.3% of the respondents consume herbal supplement, in which maybe it's better, but sometimes maybe it can worsen the CKD, if they are taking wrongly. So for the past medical history, you can see that most of the respondents have hypertension, diabetic, heart disease. All these medical history are the common factors for the CKD. And how about the healthcare provider, the family history? There is a number of population have a family history of healthcare provider, and they also have kidney disease. For the last renal function screening, if you see, 21.5% never tested. And I think I can ask in this room, how many of us been tested our renal function test? So 11.6% do not remember whether they are doing that or not. So this shows that our awareness about our kidney health is quite inadequate. Okay, so for attended CKD, only 40.8% have a formal education on CKD. This indicates that more than 50% or half of them are not aware actually getting a proper education about the CKD, the chronic kidney disease. How about the source of health information? Most of them have the information from social media. This shows that the social media or the online is a platform, it's a good platform for disseminate the awareness program. How about if they get improper education or improper information? Next. So, for the objective number 1, the prevalence of CKD shows that 11.51%, 11.5 mean with 63% of the respondents score below 12, means the respondents have low CKD knowledge. If you see at the literature that, okay, if you see the literature here, that most of the study conducted also shows that. Yeah.
You have only 1 minute.
Yeah, I know. Okay, so it shows that the worldwide universal found that the CKD knowledge is poor. There are more better knowledge on diagnostic tests, in which diagnostic test is not one of the major common problem. The major problem is how to early detect the sign and symptom, in which this is the poor domain under the whole education and knowledge. Next. Okay, if you see here, all the variable, the demographic characteristic, the lifestyle has associate with the knowledge. How about the past medical history? In this study shows that if the patient have past medical history like diabetes and heart disease, they manage to have better knowledge. Why? Because they go to the clinic so they can get a normal information about CKD. How about the family history? Immediate family history work as healthcare provider and family history of CKD have a better knowledge. Why? Because they can discuss or maybe with their experiences. The last renal function test shows that if you are currently tested your renal function test, you will have a better knowledge. And last is attended CKD awareness. As of course, when you attend education, you will have a knowledge about the CKD. However, if you see there is a contra there with a study done by UNES. Why? It's because of how is the content being delivered and how it being delivered to the patient. Thanks. So this is the conclusion, 1 minute. Okay, this highlights significant knowledge here about the CKD, awareness about Malaysia. While respondents understood certain aspects, but they lacked in other respects, especially the kidney function. Risk factor as diabetic is noted in this study, but how about the hypertension and obesity? There is a lack of acknowledgement. CKD knowledge were influenced by all the demographic, lifestyle, and medical history. So, in this study, recommended target educational intervention are essential to improve awareness in early detection and management, integrating CKD education into CKD care and public health campaign can enhance prevention, slow degree progression, and improve overall kidney outcome. Last. This is the references last.
Thank you.
Last. Please don't ignore.
Thank you for that.
Thank you very much.
Alright, thank you for that passionate delivery. I mean, giving you the extra minute is worth it because of the importance of these to our health, collective health. Alright, do we have any comments or questions from other participants?
Sorry, Doctor. I have questions.
You know the figure you gave. All right.
Okay, just want to ask. Okay, for the population from 18 to 25, I think they get not enough money to pay for check to the clinic, maybe, because sometimes I know about the chronic, but when we are going to the hospital, we are asking, how about my kidney? Oh, everything's good, good. We have the awareness about that, but unfortunately, when I go to the hospital, they said, yeah, your kidney is good. But suddenly, my friend, this is my experience, after 3 months, he got the very chronic kidneys. So sometimes we have the awareness to do it, but sometimes the people cannot afford to go to the specialist to check the detail about the chronic. So maybe can you experience
Okay.
something?
So actually, in government or Ministry of Health, we have lots of campaign in order to give awareness to public. Sometimes you can see in shopping malls. I think the campaign for health is a good and very advanced in Malaysia. It's up to the person who wants to smoke, same as the breastfeeding, because the breastfeeding education been given to all of our population, but how they want to admit it is up to the
Sorry,
population.
Doctor. Like HIV, they get made up for NGOs. They said, okay, just come to our NGOs, we test to you, and then you get the HIV on it. So we got the results, and then they give direct one-to-one for the awareness. But how about the CKD?
We have kidney foundation, and
It's available for everybody.
That's the reason why I told just now, the knowledge, the awareness about the CKD is poor. So how is we as a Ministry of Health or the healthcare provider able to disseminate all this information to our public? So we thought that we already gave with all this campaign, but it's up to the general population to manage the test. As just now I told, the early sign, public need to know the early sign, not the diagnostic. When you go to the hospital or clinic for the diagnostic test, actually it's already late. You need to know about the early sign so that you can aware and you can go to seek for medical attention.
Because sometimes the vomiting is very general sign.
Let me ask a question that's related to that one. Is the testing of the kidney free?
Yeah, for the government
Is
hospital.
it free to test?
For the government clinic in Malaysia, okay, we can easily go to any public clinic to do any testing if we have identified the early sign. Or maybe if you age 35 and above, in which you already have this kind of risk factor, you can go anywhere. It's not only to go to the private sector. Of course, when you go to the private sector, you need to pay. You can easily get the services, but you need to pay. But government sector is openly for our general population to do all this testing. Yes. Is that answer your question?
Then, okay.
Okay, there is a question.
Yeah, I think so. But there's a question there.
Okay, I agree that when we have a sign, then we need to go to the government, those unfortunate people. But how long that we need to wait? If you have the sign, maybe we should already go to the hospital, and then because of the hierarchy, we need to wait at least for 3 months to see the specialist. So at that time, it's already been chronic.
Okay. It's a good question regarding the diagnostic test. We have a few of diagnostic tests to to determine the CKD. So if you want to have a deeper, that's why you need to have a longer time for us to do the diagnostic test. But we can use a simple test as our urine. If you know, when you pass urine, when your urine is bubbling, that shows that our kidney is not that healthy. So these kind of things doesn't mean you need to do the investigation, the awareness. But as I told you just now, there is a few of testing to diagnose the CKD. So it depends to how long to diagnose the real CKD. Does that answer your question? All right. Okay.
All right, thank you very much. The interaction can continue with the presenter later. Thank you for that presentation. Please still see her if you have more questions on chronic kidney disease. So we have balance and caregiver burden among parents of children with autism spectrum disorder. Is that Associate Professor Dr. Mohammed Sulaiman Murad?
Assalamualaikum and very good afternoon, ladies and gentlemen, especially to Prof. Jaiyeoba from Nigeria. Thank you very much. So my title together with my colleague, my master student, Dr. Shamsul and Dr. Usif from Indonesia. Indonesia. So my title is about occupational balance and caregiver burden among parents of children with autism spectrum disorders. Okay. As you all know that when talk about occupational balance is about our balance in our life, especially our daily living, our work, leisure, which is very important for us. If the thing not balanced, you are not well. This is very important. Another thing, caregiver burden is more on psychology. Your feeling of taking care of the children with autism spectrum disorder. As you all know that autism is quite challenging. I know, I mean, this effect not only communication, but their behavior, their interactions or that, depends on the IQ. If the IQ severe, it becomes more challenges. And in Malaysia, the diagnosis is increasing tremendously. So you can see that about right now, this is from 2000 to 2020, the number increasing is about 370%. So not in ICF, International Classification of Functioning and Disability, it's not only about the functional aspect. We have to intervene, but also the contextual factors, which is the personal factors and the environment. When talk about environment, it's about not only the physical aspect, like building, that you all previously have discussed, but also the person, which is the parents. So this is why we make this study to understand what are their status and what are the link between occupational balance and also their caregiver burden. Okay? So when talk about, there is a lot of detail I want to highlight. The very important thing we need to understand not only the people but also the culture. The culture and also the system, the support system, especially in Malaysia. And no prior studies been done in Malaysia. This is my aims to examine, is there any relationship between occupational balance and also caregiver burden, and then to identify the level, the differences of the demographic data of the parents. So we have 89 parents participate. This is from Klang Valley, which is from National Association of Malaysia. So we use Zahid's burden. So we have Zahid's burden and occupational balance. So these two feedback questionnaire is very sensitive, valid and reliable. So after that we analyze using SPSS. And we found that the participant involved mostly is the mothers. And the age range from 31 to 40 years and is more on Malay races. Yeah? Malay, they are married and they are tertiary level education, mostly. And they came from middle income household. So we found the key result is that the higher care burden among Malay parents is significant. Malay, yeah? This because the numbers is Malay, but we found that there is significant in terms of caregiver burden. However, we found that the correlation is moderate and not significant because probably the numbers, the sample size is not enough. Yeah? And in our discussion, we found that when the parents getting older, they are more experienced in terms of taking care of their children with autism. Yeah? And then the cultural norms in Malaysian society could explain the higher burden among Malay parents. And then we found that single parents are more struggle in terms of taking care due to limited support. And then higher income is linked to lower burden and better occupational balance, while financial strain impacts low income family. And then well-educated parents may feel more burden, but access resources to maintain occupational balance. Strong spiritual beliefs and social support need they help maintain occupational balance across different racial backgrounds. And in this study, we conclude that the study highlights the intervened nature of caregiver burden and occupational balance among parents. Older parents, mothers, and those in low-income groups experience higher caregiver burden. Factors such as education, financial resource, and coping strategies contribute to occupational balance. Although no statistically significant correlation was found, the negative trend, such as the intervention aimed at improving occupational balance, could help reduce caregiver burden. So our recommendation, future studies should use longitudinal approach, include qualitative insight, which is more on narrative interviewing and etc. And a control group of parents with typically developing children. Examine the impact of ASD severity, because in our study we didn't level the severity. Yeah? This is the limitation we have, and we recommend in future that there is a categorical or group of moderate, severe, mild autism children. Yeah? Because the challenges is more. When they are more severe, the challenges for the parents is more. Yeah? And then we focus on diverse socioeconomic and cultural background. Because in our study, most of the participants is only Malay parents. We should observe more on different races such as Chinese, Indian, and etc. I think that's from me. Not so much, but if you're interested, look and read my paper. That's all, bro. Thank you.
Thank you very much for that summary of your paper.
Yeah, bro.
That I'll also invite other people to go and read it, just like you have invited them. That's good. Do we have any immediate questions or comments on this paper on parents of autism?
Yeah. Children with autism, yeah.
Spectrum disorder. If there's no immediate comment, something worries me.
Yeah, bro.
It looks like from your graph, this disorder has increased rapidly from year 2000.
Yeah, bro. Can you highlight the graph, please?
Well,
okay.
yes.
Okay.
What do you think
The increase is due to the several factors, Prof. Probably awareness of the parents. I know parents aware in terms of the criteria of diagnostic of autism spectrum disorder. The next one is about technology and the criteria of diagnostic of the specialists who are able to diagnose as early as possible. Even when they are baby, we are able to, doctors, especially doctors, able to diagnose as early as possible. This is very important, right? Because the children need to be intervened as soon as possible. Don't drag it until they are adult. So as a parent, we have to be aware with our children. The more you aware, the more you understand their issue, especially their diagnosis. So easy for us. I'm from background of occupational therapy. Our role is to do early intervention for them. So our intervention not only focus at the children with autism, but also we have to look into environmental factor, which is the people. When talk about the people, is the parents. So probably in our study we can suggest to the government not only focus on the children, but also focus on the parents. They need support, Prof. They need support because when they taking care of the challenges of autism, they affect their occupational balance and also their psychology. Psychology when they taking care of autism with many challenges, Prof. Yeah.
Okay. And part of your findings says that older parents are able to cope better with caregivers.
Yeah.
Or as caregivers.
Yeah.
What accounts for that?
The more they experience, because some of them, they not only deal by themselves. When the child grow, they have support from the health professional, from the parents who have children with autism spectrum disorders, so they share information from. And then at that time, at that age, probably their financial is quite stable. Then they're getting more income, higher income, and then probably their time to spend with their children is more, rather than they have to work 24 hours, because they are in their stable income.
Okay. I want a little bit of clarification.
Yeah, bro.
The parents you studied, are they those that have assistants, maybe as caregivers, or those without?
Yeah, depends on the level of income, bro. So there is middle income, lower income, and higher income. So higher income, their financial economy quite stable. They can hire maid. However, when talk about children with autism, it's not about we give the maid to take care. It's involved of the parents together to take care of their children. Even though they have maid, but they have also have to take care of their children.
Okay, that's good. So what's the next stage in this?
The next stage is, Prof, we're going to do longitudinal study. This is about cross-sectional study. At the same time, probably we can propose to our government or to our hospital, rehab center, to come up with a support group for younger parents who having children with autism. So we are in the process of propose research grant to come up with a clinical trial or control group intervention, so we are able to measure whether the thing effective or not.
Okay, this is wonderful. Thank you very much.
Thank you, Prof.
Can I have question, Doctor? Can I have question?
Yes.
Just now, Doctor, your findings are not significant, is it?
There is a moderate link, however, it's not significant.
How many samples do you
84 sample.
84.
Oh, yeah, 84. Actually, we need more than 120 sample size as stipulated in the loss of sample size.
You use SPSS?
Yes, of course.
Maybe I would suggest you to try running your data using Smart PLS. Since the software are sample friendly.
Oh yeah. Oh, I haven't heard this. Probably we can discuss later on. Okay? Okay, thank you very much for your suggestion.
That's good. That's good. That's good. So we have the last presentation for this very interesting breakout is turning out to be is on pack design attributes for mental restoration, a systematic review and a thematic analysis. It's going to be by Sharifa Haliza Sieg Usman Khan and with 3 other authors.
Okay, thank you very much, Prof. Assalamualaikum and good afternoon to all the audience here. My name is Sharifa Khaliza Syed Osman Kani, and on behalf of my co-authors, Zainul Azmi, Nurhanisa Muhammad Hashim, and Jasmine Bakhtiar, I will present on the systematic study entitled Park Design Attributes for Mental Restoration.
Is any of your co-authors online?
No, I'm alone here. I mean, I will present it alone. Okay, I think the topics on mental health is not a taboo anymore nowadays. It has been extensively debated and discussed among the mental health care practitioners and also across other disciplines too. And for landscape architects, landscape professionals, especially in Malaysia too, we started, this is quite an emerging field that are hot, in trends nowadays, even in the design field. So, according to the World Health Organization, nearly 1 billion worldwide having mental disorders or mental health problems, such as psychosocial disabilities like associated with significant distress, especially this affected the cognitive function of human. Okay, and one of the major factors, that's why the architects, the urban planners, the landscape professionals nowadays come in hands discussing about these emerging trends. This is because stress relatively significant. The most contributing factors is the urban stresses, or the elements in our urban settings do contribute to the risk of developing stress, depression, and major psychological issues. So city lifestyle, flashy elements, lights, and so on. And then the rapid pace of city lifestyle and the setting of the environments do affect our brain biology and modify our cognitive function, right? So, how do these urban stresses versus urban brain, what is the comparison and how does it influence our brain? Okay, so when exposed to urban stresses, the two areas of the brains, particularly your prefrontal and frontal brain, your brain, it will be stimulated and it will the overloading of stimulation comes from external factors would eventually modify our brain biology. Yeah? So if you see here, there's a stark comparison between the stress and unstressed brain. So the stressed brain, when you are overstimulating by the urban or external factors, it could affect the frontal and prefrontal cortex and amygdala. Amygdala is the one who control our stress levels or brain neurons. Yeah. So this will result in a weaker control of thoughts and emotions and action, whereas the unstressed brain, the less external stimulation will balancedly distribute good and positive brainwave all over the brain. So it gives the tight control of thoughts, emotion, and actions. And if we are too overloading with the external stressor, so it could eventually develop the mental fatigue. So our brain will be fatigued. So, but how can this urban dream reduce the stress or reduce the cognitive load? Okay, so this is what cliche actually, even in discussion among the landscape architect. So we know that, I think there's a vast of research saying that nature could help you. Nature has the restorative attributes. So what's more to do? What's more to do? We all know that green areas, of course, you reduce stress, you get the healing feelings when we go strolling at the park and so on and so forth. That's why this research comes along. Our study wants to see what is the specific design attributes that could contribute to the mental restoration, and this is what we do. So the first stage is we do the systematic review from the literature survey. Alright, so we use a common method in systematic review where this is based on the PRISMA checklist. So with the aim to identify the key design attributes that promote mental restoration at parks. So we use two databases, Scopus and Science Direct, and then for screening, and then and then for scoping, the search strings, we focus on three keywords: design attributes, park environment, and mental restoration for the search string, to search for the literature available from these two databases. And we filtered some of the articles are founded into these two databases, where the exclusion criteria is we only consider attributes of design attributes. Non-design attributes, we filter it out. And then in the context of park environment, so other environments such as indoor environment, we filter it out, okay? So findings unrelated to mental restoration or other external factors, we filter it out. And article less than year 2019, we filter it out because we want only the recent articles to be included, and we also exclude the non-English article. So overall, from this process, we got 16 studies included in the review. And then we did the process of thematic analysis, content analysis, and then we identified the themes that emerged from the thematic analysis, and then we synthesized the design attributes of mental restoration in park environment. And also we also identified the related theories that relate to these studies on restorative environment. So our study found four major.
You have 3 minutes.
All right, thank you, Prof. Underlying theories that relate to restorative environment. The first one is attention restoration theory from Kaplan, and this one, it is about nature connectedness with attention restoration. The second one is stress recovery theory from Roger Ulrich. The third one is arousal theory from Brian. And then the fourth one is prospect refugee theory from Appleton. Yeah? So, from these systematic studies, we identify 6 key themes. Okay? This is the key mental restoration attributes. The first one is green attributes, which consists of trees, vegetation, and so on and so forth. The second one is blue attributes, which consists of water features such as streams, lakes, and so on and so forth, wetland. And then the inclusion of non-threatening, small living animals, and then safety and activities and engagement. And then the last one is the space representation and layout. So let's take a look how these attributes could promote the mental restoration. Okay, so from this study, we conclude that trees, vegetation, and natural elements enhance directed attention. Okay, it reduces cortisol and enhances emotional stability. So this is parallel to the attention restoration theory from Kaplan. Yeah? And the rhythmic sound of water enhances mood and facilitates deep relaxation, where it could promote cognitive restoration and reduce the cortisol level of human. So this is aligned with stress recovery theory from Roger Ulrich. Yeah? And then the presence of living animals, non-threatening and small animals, the bird songs, it could trigger positive emotional responses. Yeah? It could stimulate our auditory towards positive emotion, and nature sounds support the brain's ability to refocus attention. So another thing is the activities and engagement opportunities. The walking path, the exercise zones, and relaxation areas improve neuroplasticity and enhance mental clarity. So movement gives you balance in terms of alertness and calmness. So it is parallel with the arousal theory. And then for safety, well-maintained spaces lower anxiety, creating a sense of clear security, and a safe environment reduces cognitive load, allowing the brain to focus on relaxation. Why? That's because when you feel safe, your cognitive load is reduced, and then you could get the positive emotion. Yeah? And then space layout, so attributes such as wayfinding, path signage, and visibility, and the overall layout of the path is actually interconnected, and the good overall space layout could promote the mental restoration. So as a conclusion, parks nowadays is no more a common green spaces. However, it could be one of our public health resources. Yeah? By integrating the restorative landscape, yeah? Such as the attributes like green and blue elements, the optimization of spatial design, ensuring the safety and security of the parks, and encouraging activity engagement to the park users. So all of this, if the park designed with scientifically proven restorative attributes, it could significantly enhance mental well-being and improve cognitive function towards stress reduction. So from the study too, we found out that there's a few recommendations from researchers all over the world. So the first is the future research should examine prolonged effects of parks. So nowadays, more research is more towards the short term of effect of parks, not prolonged effects of parks. Attributes on mental restoration and implications to integrate restorative features in park and planning guidelines, and to integrate accessible infrastructure, water features, organized layouts, and diverse park environments to enhance mental restoration. So I think with that, I end my presentation today. Thank you very much.
Thank you for that presentation on how landscape can affect our health in one way or the other. Are there questions or contributions for this group of authors? about park design. I have a first question. In your review, systematic review, your slide says you excluded academic journals. What does that mean?
Excluded? Come again, Prof? I'm not clear.
In your
yes.
inclusion, you know, you have inclusion and exclusion criteria in the literature review.
Okay.
Your exclusion criteria, one of them is that you didn't put academic journals. I said, what does that mean?
Academic journals?
You can go to this slide, you'll see it there. That you did not include academic journals. I just want to know what it means. That must be under methodology somewhere.
Okay. I'll check it first. Okay, Prof?
You can go back.
Yeah.
Oh.
Okay.
Oh yeah, go back.
Oh, response. Okay.
Yes,
all right.
Yes.
It's a typo actually. Reports excluded. No. It included actually academic journals, review papers, theoretical papers, methodological papers. That one is inclusion actually.
You want to say what it includes?
Yeah.
Okay.
Sorry for that. Yeah.
All right. There's the future recommendation you have. Go to the future recommendation. And down the slide before, thank you. Yes, here you said future research will examine prolonged effects of park attributes on mental restoration and emotional resilience. Can a landscape architect do that research alone?
Okay, to answer this, Prof, okay, actually, of course, landscape architect is not directly involved in the psychological system. And of course, landscape architect could not guarantee that the park design or whatsoever attributes have the positive effect 100% towards mental restoration, emotional resilience. However, we as a landscape architect, we play an integral part of this public health system actually. And because this is quite an emerging field and aspect in design as per se, there's more on the scientific part that needs to be researched or needs to be collected. Yeah? I mean, landscape architect only could study or only could research on the design parts. But we need
all right.
Yes,
other
collaborators.
Let me tell you what I'm thinking.
Right.
What I'm thinking is that you need a multidisciplinary approach.
Yes, Prof.
And that since you are the conference at this breakout with people that are into psychology and all that, you better start discussing how to jointly strategize or have a research design that includes not only landscape architects but also people from the health sector or the health faculty.
Yeah.
So you can have a collaborative research.
Yes, yes. Sure,
that really addresses something like this. I guess this is one of the purposes of conferences. So sometimes you can synergize on topics that need several disciplines to work on together. Are there any other comments from the panelists? Okay, if there are no other panelists, I say that I'd like to thank everyone that made this breakout session and the AcE-Bs2025 Bangkok, the 13th Asian Conference on Environmental Behaviour Studies. And I say once again on the note that on what I just said, that it's time for people to maximize the benefit of attending conferences by discussing and synergizing on working together, sometimes on multidisciplinary research. That is really interesting. Thank you.
Okay, Prof. Many thanks to Prof. Babatunde for joining this session. A round of applause, please.
Thank you.
Okay, thank you so much, Prof. I hope you enjoy your lunch, dinner, tea time.
Yes, I will.
Okay.
And I hope that you people over there too, you will enjoy
tea time.
Supper or
Tea time.
or is it lunch?
Yes.
Tea time now. Tea time. Okay. All right. Enjoy your tea time.
Okay, thank you so much, Prof. See you in London.
All right. See you.
Okay, so now we should have our tea time in this room. And please be punctual for the last breakout, which is breakout session 3, which will commence at 4:40 p.m. sharp. Okay? Once again, the breakout session 3 will commence at 4:40 p.m. sharp. 4:40, yeah? 4:40. Does anyone understand? Okay, good. Okay, so let's go for tea time.